Hello and welcome to our YouTube channel. Today we are going to discuss benign prostatic hyperplasia. Please pause this video and to get complete understanding of the non-prostatic hyperplasia, we shall discuss what is benign prostatic hyperplasia, causes, signs and symptoms, treatment, prevention, complication. Benign prostatic hyperplasia, also called prostate gland enlargement, is a common condition as men get older. An enlarged prostate gland can cause uncontrollable urinary symptoms such as blocking the flow of urine out of the bladder. It can also cause bladder, urinary tract or kidney problems. Let's discuss the signs and the symptoms. Since the prostate glands around the urethra is the tube that carries urine outside the body, it is easy to understand that enlargement of the prostate can lead to drops of tube. Therefore, you may develop early symptoms of benign prostatic hyperplasia, slowness or dribbling of sure during this stream of hesitancy or difficulty starting to urinate, frequent urination, need to get up at night to urinate, pain after ejaculation or while urinating, urine that looks or smells funny, frequent or urgent need to urinate, difficulty starting urination, with during stream or a stream that stops or starts, inability to completely empty the bladder. These are the symptoms of the benign prostatic hyperplasia. The prostate gland is a walnut-shaped gland that is part of a male reproductive system. The main function of prostate is to make a fluid that goes into semen. Prostate fluid is essential for the man's fertility. Now let's see the causes. The causes of benign prostatic hyperplasia are not clear. It mainly occur in older men. Hormone changes are thought to play a role. Hormones from the testes may be the main factor. For example, as men age, the amount of active testosterone in the blood decline, estrogen levels stay the same. Benign prostatic hyperplasia may occur when these hormone changes trigger posted cell growth. Another theory is about the role of the hydroxytestosterone. This male hormone supports prostate development. Some studies showed that older males have higher level of dry hydroxytestosterone. Testosterone levels go down. How prostate hyperplasia is diagonal. Union lysis. Your urine is checked for HA, blood or bacterium. Zero dynamic test. Your bladder is filled with a liquid. Where are the theta to measure your blood and pressure during urination? Those that have specific antigen, as this blood test checks for cancer of frosted gland. Cystoscopy. This is the examination of your urethra and bladder with a tiny lighted skull that inserted into your urethra. Urinary floor test. You urinate into a spectacle attached to the machine that the strength and amount of sugar urine flow test results help determine our time if your condition is getting better or worse. Post-void residual volume test. This test measures whether you can emphasize your bladder completely. The test can be done using ultrasound or by inserting a catheter into your bladder after you urinate. To my earth. How much urine is left into your bladder? 24-hour voiding diary recording the frequency and amount of urine might be especially helpful if more than 1/3 of you are there. With Uranus output occurs at night. Treatment option for benign prostatic hyperplasia include lifestyle changes, medication, minimally incessant procedure, surgery. A healthcare provider treats benign prostatic hyperplasia based on the severity of symptoms. How much the symptoms affect the men. Daily life in the men's preferences. Men may not need treatment for mercy. Regards first, and unless their symptoms are bothersome and affecting their quality of life. In these cases, instead of treatment, a urologist may comment. Regular Jacobs. If the benign prostatic hyperplasia symptoms become bothersome or present and healthy ideologies most often recommend treatment. Lifestyle changes. Healthcare provider help may recommend lifestyle changes for men whose symptoms are mild or slightly for the son. Lifestyle changes can include reducing intake of liquid, particularly before going out in public or before period of sleep, avoiding or reducing intake of caffeinated beverages and alcohol, avoiding or monitoring the use of medications such as antihistamines, antidepressants, or diuretics, training the bladder to hold watering for longer period, exercising pelvic floor muscles, preventing or treating constipation, medication A healthcare provider or urologist may prescribe medication that stop the growth of or shrink the prostate or reduce the symptoms associated with benign prostatic hyperplasia. Alpha blockers, phosphorodiester 5 inhibitors. Let's discuss about the prevention. There is no sure way to prevent benign prostatic hyperplasia. Still, losing weight and eating a well-done diet rich in fruits and vegetables may hurt. Too much body fat may increase the hormone levels and other factors in the blood and stimulate the growth of prostate cells. Staying active also helps control weight and hormone level. Men with risk factors for benign prostatic hyperplasia should talk with the healthcare provider about any originally tracked symptoms and the need of regular prostate exams. Men can get always treatment and minimize benign prostatic hyperplasia, a fact by recognizing your indented tract symptoms and identify and large prostate. Complications: urinary tract infections, insurance restraint, kidney damage, bleeding in the urinary tract, a sudden inability to urinate, bladder damage. Dietary requirement for benign prostatic hyperplasia patient: food to eat salmon, berries, onion and garlic, green leafy vegetables, tomatoes and other citrus food, nuts, sesame seeds, tofu and sofa, soy product. Put white red meat, coffee, sodium, eggs, and poultry, dairy, alcohol and spicy food.